Brianna Ballinger. I'm going to be assessing you today. I'm going to be your nurse. I just want to let you know you do have the right to confidentiality and you do have the right to refuse any kind of treatment or this assessment. Do you understand?
Yes.
And you do agree to the assessment?
Yes.
Okay, great. My name is Brianna Ballinger and I'm going to be doing my physical assessment today. Okay, I'm going to inspect the skin on the face. I think it looks good, no lesions, skin's not overly oily. Okay. Palpate the scalp and cranium. Is that tender? No? Okay. And then look at your expression for symmetry. Okay, looks good. Then palpate your temporal arteries. Okay, that one's good. This one, same. They're both equal. Gonna palpate your TMJ. Let's see. Can you open your mouth for me? Okay, close it. Good. Okay, we're going to assess cranial nerve 5 now. Can you clench your teeth together? Okay, now we're going to pull down. Okay, good. Okay. Use my cotton list. Let me know if you can feel this, okay? Can you feel that?
Mm-hmm.
Okay, can you feel that?
Yep.
Okay. Okay, cranial nerve 7. Can you smile, frown, close your eyes tightly? Lift your eyebrows for me. Open them. Yeah. Okay. Show me your teeth. And you puff your cheeks out for me. Okay. Alright. Okay. We're going to test visual acuity. We're going to do the smelling chart. Okay. Alright. I want you to cover up one eye. I want you to read the lowest line that you can see.
It's going to be F-E-L-O-P-Z-D.
Okay. Now take that one down. I want you to cover up the other eye and read the lowest line you can see.
F-E-L-O-P-Z-D.
Okay. Now just take both down and read normal.
F-E-L-O-P-Z-D.
Okay. Looks like you got 20/25 vision. If you want to step back in here for me. Okay, now I'm going to test cranial nerves 3, 4, and 6. Okay, I want you to just follow my pen, okay? Can you see up here, on the side, down. Okay, now we're going to test over here on this side. Up, to the side, down. Okay, I'm going to turn the lights off for just a second. You see them? Alright, I'm going to shine light in your eye. Okay. Okay, the pupils did constrict. Okay, pupils also constricted there. Okay, they're both constricted equally. I'm going to test for accommodation and convergence. Okay, what I want you to do is just follow my pen all the way to your nose, okay? Okay, the pupils did constrict and the eyes followed. I'm going to palpate the external eye structures. See your eyebrows, lashes. Can you look up at me? Okay, pull your glasses down. Okay, that works too. Okay. Feel any tenderness? Anything like that?
No.
Okay. Can you look at me? Okay. Look up. Okay. Corneas both are white. Everything looks good. Sclera is fine. Conjunctiva. Let's see. They're both pink. Alright. Okay, now I'm going to test cranial nerves 3, 4, and 6. Okay. I want you to just follow my pen, okay? Can you see up here? On the side, down. Okay, now we're going to test over here on this side. Up, to the side, down. Okay, I'm going to turn the lights off for just a second. You see them? Alright, I'm going to shine light in your eye. Okay. Okay, the pupils did constrict. Okay, pupils also constricted there. Okay, they're both constricted equally. I'm going to test for accommodation and convergence. Okay, what I want you to do is just follow my pen all the way to your nose, okay? Okay, the pupils did constrict and the eyes followed. I'm going to palpate the external eye structures. See your eyebrows. Lashes, can you look up at me? Okay, pull your glasses down. Okay, that works too. Okay. Feel any tenderness? Anything like that?
Nope.
Okay. Can you look at me? Okay. Look up. Okay. Corneas both are white. Everything looks good. Sclera is fine. Conjunctiva, let's see. They're both pink. Alright. Okay. I'm going to inspect the outer ears. Okay. This one. Everything looks good. There's no redness or swelling at the side. There's no earwax buildup. Okay. The right side, same. They both look equal bilaterally. No swelling or buildup of earwax or redness. Okay. Now I'm going to test cranial nerve 8 with the whispered voice test. Okay, I'm going to cover up this ear and I'm going to whisper over here and you tell me what I said. Red.
Red.
Okay.
Green.
Okay. Cool. Okay, now I'm going to inspect and palpate the external nose. I need you to tell me if you feel any tenderness, pain, anything like that. Nothing?
No.
Okay. I'm going to test for patency of each nostril. I want you to take one finger and occlude. Now breathe in, breathe out. Okay, do the same thing on this side. Okay, good. No occlusions. That's good. Alright, I'm going to palpate the sinuses, the maxillary down here. Can you tell me if you feel any tenderness? Nothing?
No.
Okay, any tenderness over here in the frontal?
No.
Okay, good. Okay, now I'm going to inspect your mouth. Can you open your mouth for me? Okay. Alright, looking at your teeth. They are white, clean. Your buccal mucosa is wet. I don't see any ulcers or lesions or anything like that. Okay, and your palate, it is intact, pink. Floor of your mouth looks fine. It's pink and moist. Can you stick your tongue out for me? Okay, everything looks intact there. Looks good. Okay, you can close your mouth. Okay, open one more time. Say ah. So you can say ah. Okay, back of the throat looks fine. The uvula is present in pink. And it moved up when he said ah. Okay, I cannot assess this patient's tonsils because he did have them removed. Okay, I'm going to assess cranial nerves 9 and 10. Okay, can you open your mouth for me? Stick your tongue out. Okay. Okay. He said ah. Alright, the uvula did move up when the patient said ah. Okay, we've got to test your gag reflex. Okay, gag reflex is present. Okay, cranial nerve 12. Can you stick your tongue out for me? Okay, move it from side to side. Okay, it looks symmetrical. Everything's good there. Okay, now we're going to be palpating the lymph nodes. This is pre-auricular, post-auricular. Okay. Let's see. Submandibular, submental. Okay. Occipital. Let's put it back here. Okay, those are good. Let's see. Post-cervical. Interior. No, I'm sorry. Post-cervical. Interior cervical. Okay. Supraclavicular is going to be here. Okay. Tonsillar. Okay, deep cervical chain is going to be right here. Okay, and superficial cervical. Way back there. Any tenderness, any pain?
No.
Okay, good. I'm going to be assessing cranial nerve 11. Let me ask you to look that way for me. Okay, now look this way. Alright, touch your chin to your chest. Okay, now look up. Alright, okay. Now just look straight at me. Touch ear to your shoulder. Ear to your shoulder. Okay, now I'm going to push against me. Okay, there. Good. That way. Okay. Alright. Okay, good. Alright, now I gotta palpate your thyroid. Okay. Swallow for me. Okay, good. Thyroid did move up. Now I'm gonna assess the carotid arteries. Let's see. Okay, got a good pulse there. Good pulse there. Alright, now I'm going to auscultate them. Listen for a groovy. Okay, nothing there. Okay, good. Nothing there. Alright. I'm going to inspect the posterior and lateral chest. Okay, I'm going to palpate. Let's see. Feel any tenderness?
Nope.
No? Okay, and there are no rash, lesions, anything on his back. Okay. I'm going to put my hands right here. I want you to say 99.
99.
Okay.
99.
Okay.
99.
Okay.
99. 99. 99.
Okay, good. Alright. Let's see. Now I'm going to percuss over the lung field. Okay. Alright. Okay. Now I'm going to test for flank tenderness. Let me know if this feels uncomfortable. Anything?
Nope.
Okay. One more time.
Nope.
Nope. Okay, great. Alright. Now I'm just going to listen to all your breath sounds. So when you feel the stethoscope, take a deep breath. Okay? Okay. Clear. Okay. All right. Okay. Good. All right. All right. We'll assess for symmetry. So just take one more deep breath. Okay. Great. My hands spaced out evenly. Okay. Good. For extremities. Okay. Can I see your arm? Okay. Just assessing for edema, any scratches, rashes, anything like that. No edema. Everything looks good. Okay. So I'm going to palpate radial. Okay. Brachial. That was a little hard to find, but yeah, got it. And ulnar. Okay, it's kind of faint. Same thing on this arm. Okay, radial. Okay, that was normal. Brachial. Okay. All of them are +2 and they're normal. Okay, let's see. You're gonna shake your fingers. Alright, capillary fill, brisk, less than 2 seconds. bilaterally. Alright, now I'm going to ask you to raise your arms above your head. Okay, come down, go behind your back. Okay, now I want you to keep your arms at your side. Alright, now, bring it back down. Okay? So, we're going to assess the range of motion of the elbows. Okay, what I want you to do, like this. Okay, now bring it in. Alright. Okay, now, do this. Okay, now turn them over. Okay, well, stretch your arms all the way out as far as you can. Okay, now, do it. Good. Okay, good. Alright, now we're going to test strength. Okay? Alright, now try and pull back. Alright, now push down. Okay. Alright, now we're going to assess the range of motion of your wrists. Okay? Now, what you do is stand up with both hands. Okay, stand down. Okay, do this. Drop it on. Okay? Alright, open your hand. Okay, then close your fingers. Okay. Alright, now touch each finger to your thumb like this. Okay, great. Alright. Now, okay. Now I want you to have your arms out. Okay, now, touch your nose, go out, touch your nose, and do both. Okay? Alright. Now, I'm going to close your eyes for me. I'm going to write a number in your hand, and I want you to tell me the number that I wrote.
3,
Okay?
6,
Okay. Alright. Again.
7,
Okay. Okay.
8,
Okay. Alright. Good. Okay. Alright. Same idea, different exercise. Alright, I'm going to place an object in your hand, and I want you to tell me what that object is.
it's a key.
Okay? Alright, this end.
Paperclip.
Okay. Alright. And we're going to test your reflexes. Alright. Okay. Let's start here. Okay. Okay, good. Now, let's see. I'll do this one. Okay, good. Alright. I'll do it on this one too. Yes. Okay, good. Alright. Good. Okay, good. Alright. Okay, now I'm going to assess the anterior chest. Okay, I'm going to palpate. Well, let's back first. Everything looks good. I don't see any rashes, lesions, skin breakdown anywhere. Okay. Alright, I'm going to palpate. No tenderness there that you can feel? No? Okay, good. Alright. This breathing looks fine. Does not look labored in any way. Okay. Palpate precordium. Okay. Assess the PMI. Okay, I do feel that pulsation there. I don't feel any heaves or frills, anything like that. Okay. Now we should listen to your heart. Okay. Okay. Aortic. Melanic. Tricuspid. And mitral. Okay, let's listen again with the bell. Okay. Okay. now I'm going to assess the abdomen. Okay. Alright. Skin looks normal. Don't see any lesions, scars, any skin breakdown, anything like that. Okay. Contoured, a little rounded. Everything looks symmetrical. Okay. Let's see. I do see a a pulsation here. Okay. Umbilicus, it is symmetrical. No hernias or anything like that noticed. Alright. Okay. Now I'm just going to listen to you. Start with the left lower quadrant. Okay. Left upper quadrant. I'm sorry. Right lower, right upper. Okay, now left upper. Left lower. Okay, I did hear active bowel sounds in all 4 quadrants. Okay. Let's see. Okay. I'm going to also take aorta above the umbilicus. Okay. The renal arteries. Okay. Okay. Okay, I'm going to percuss all 4 quadrants. Alright. Let's see. Okay. I'll do light palpation. Alright. Now the room does feel a little tight. Okay. Alright, now deep palpation. Okay. Alright, palpate the liver now. Okay. Now I'm going to assess the lower extremities. Alright. I'm inspecting both legs, lesions, edema, nothing is present. Okay. Alright, I'm going to palpate popliteal pulse. Okay, those are palpable. Okay, that one is also palpable. Normal. Okay, assessing the posterior tibial. Okay, that one is also palpable and normal, +2. Posterior tibial, palpable and normal. Okay, now I'm going to assess the dorsalis pedis. Okay, that one's normal, +2, palpable. Okay, dorsalis pedis on this one. That one's also +2 and palpable. Okay, now what's this for pretibial edema on both legs? There is none. No edema at all noted. Okay, now I'm going to have you do, I'm going to test for range of motion on your hip. So if you could lift your leg up 90 degrees. Okay, good. All right, bring it down. Okay. Lift this one up also. Bring it up. Okay. All right, that's good. And now I want you to rotate this leg. Bring it up here. Okay, now push it out. Okay, now bring it back in. Okay, I want you to do that again with this leg. Okay, good deal. Okay. And you just bring your leg up one more time. Set it down. Okay, now bring it back down. Okay, this leg also do the same thing. Okay. Okay, now just pick your leg straight up in the air. Oh, yep, right there. Now put it down. Okay, now straight up in the air. Okay, put it down. Okay, good deal. Alright, now I'm going to set both of your ankles, and I want you to pull your foot up as far as you can back here. Okay, now push it back down. Okay, this one same thing, put it up, back down. Okay, now I want you to push against, like you're pushing a gas pedal. Okay, same thing. Okay, great. Alright, now I need you to sit up. Okay, now I'm going to test your reflexes. Okay, this is the patellar. Okay. Alright. Okay. Alright, lay it down for me. Okay. Alright. This is the Achilles. Alright, just relax your foot for me. Okay. Okay. Alright. Oh, okay. And then Babitsky. Okay. Okay. Alright. And now I'm going to ask you to take your heel and run it down your leg on both sides. Okay. Same thing on the other side. Alright. Okay. Alright, could you stand up for me, please? Alright. I'm going to set your lower extremities. Alright, what I'm going to ask you to do, I want you to walk on your heels. Alright, now when you turn around, I want you to walk on your toes. Okay, everything looks good. Alright, we're going to perform a test, what's called Romberg. I want you to stand both your legs together. Alright, push up one foot and see if you can balance. Okay, good. Alright. Alright, next thing I want you to do, I want you to pick up one leg and hop. Okay, that's good. Next leg, do the same thing. Okay. Alright. Favor, can you look towards our sample as well? Okay, now assessing your spine. Okay, everything looks good. Shoulders are even, spine looks straight. Okay. Healthy. Alright, everything feels okay. Alright. Okay, assess range of motion. Okay, what I'm going to ask you to do, can you turn around for me? Alright, I want you to bend forward and try and touch your toes. Awesome. Alright, now bring this way. Okay, back the other way. And backwards. Okay, now forward. Okay. Okay, now next thing I want you to do is twist your shoulders like this. Alright. Everything looks good.